There's a study going on right now with the Dr. Lisa Newman from Texas, who is going back to Ghana because there is a triple negative cancer that's being diagnosed in women in Ghana. It's more prevalent in us, and they go back to Tuskegee and the study that was done there. But also, when you see people making you wait to get appointments within the healthcare systems and the treatment that you get when you get there, all of those create health disparities. And they're not necessarily intentional, but if you don't speak English and you go someplace for health care and the people are talking to you like you're an idiot, if they're talking loud to you, if they're saying like first grade words like you can't understand them because you're ignorant and it's just because you don't speak English, that creates a disparity. If I talk to you out in the open about your health insurance, when's the last time you had a PAC and did you have a disease, a communicable disease, then you don't want to talk to me out in public. You don't want to sit somewhere. All of those are systemic problems that are created by the system that keep people from going. So that is it. But we have to rise above that because you're never going to change a racist to being a person who loves a person of color or anybody else. It's about your own health. It's about you taking charge of your own health. It's wonderful to have these people in the room with these displays, and it's nice that they give these things away, but you all need to take the material, read it, share it, and understand what's in it. Now, in the state of Connecticut, there is a program that will pay for a mammogram, a PAP, a pelvic, and a clinical breast exam for any woman over the age of 40 who doesn't have health insurance. And we are out here trying to make sure that we take advantage of that program, because when you don't use those funds, they get shifted into something else. And women and young girls, I don't want you to think it's an old woman's disease. And men, I don't want you to think it's a woman's disease either. If you have breast tissue, if you have breasts, it is a man's disease and it is a woman's disease. Men get breast cancer too. And it is not an old woman's disease, because we have someone here that was 28 when she was diagnosed with breast cancer. So listen, there's some things you can do and there's some things you have no control over. You have no control over your hereditary factors. So if you have that factor, you just need to check your breast more frequently. But if you go get an annual mammogram every single year, that's the first line of defense. There is really no prevention. It's about early detection, and it's about following up after you receive some information from your doctor. And then the other thing, and this is for all the young women, if you have breast tissue, if you are starting to develop, you young ladies need to be checking your breast, and you need to buddy with your mother or your grandmother or your caregiver that's a female, and go over that with you, because you need to learn early what your breasts feel like, what is lumpy, bumpy, what is tissue, and what is a lump. And if you can start learning that now, when you're 14, 13, and young ladies develop so much earlier, you start learning that now, that when you are 19 or 20 and you see some changes, you will know what it is and you can move on it. And so we're going to work toward doing something with the young people so we can start getting them ready and prepared for the things that they need to know about their health. Because I really believe our hope and faith are in the young people, that if you start to train them about these things are just natural to take care of them and follow this path, they will be in better health than we are at our age. And that we have to break that bind that's holding us back from going to the doctors. If you have a healthcare provider, use your healthcare provider. If you don't have health insurance, there are so many programs out here that provide free screenings. You have to tap into them. And then if you need a mammogram, or if you need some help, or you need somebody, you can always call the Witness Project. We just don't find breast cancer problems and mammograms. When people say they need help, we identify resources in the community. And one of your best resources in the community health centers, because they will never turn anybody away. And they know the business of dealing with people in their communities. So I want to thank you for that opportunity, and if anybody has any questions for me on breast cancer, I'd be glad to answer. Right. So get your annual mammogram, women, and teach your young daughters about breast health care. And we've got some nice stuff on the table.
Thank you for tonight. We thank you that we can gather here and further explore how we can heal the schism between mind, body, and spirit, because you created all, mind, body, and spirit. So we thank you for Dr. Aery. We thank you for Sister Kendra Smith. We thank you for the wisdom you're going to pour in them through their own life experiences, to inspire us, to be instructive to us, and ultimately challenge us to do the best we can with what we have. Bless now, in the name of your Son Jesus, I pray. Amen. Aery, and we look forward to just an awesome continuation of what we know privilege to present for greetings our very own superintendent. And I'm thankful publicly for Dr. Ramos and all that he does to make this district move. Come on, let's thank God for Dr. Ramos. Oh, that voice, huh? Very best Morehouse man, too. You know that, right? Yeah. My son just graduated from Morehouse. So I want to welcome you all here tonight and to just tell you how excited we are. That's all right. We think they will be really excited to move on because they're going to do a good job when they come into our school buildings and prepare to learn. And we also want to announce that we're making another step to help all of our students be successful. You know, there's this idea that we kind of, it's a narrow road that students have to go down to graduate, to come into our schools, and there's only so much that we offer, particularly districts like this one because we can't afford it. And so we want to use these students along the way. And that's just not acceptable. President Obama talks very clearly about that, doesn't he? It's just not acceptable. And so we have to redouble our efforts in this regard. And so what I would like to announce tonight and look forward to help that.
We are working meanwhile on creating some programs that we can put in place so that those students we can interest in coming back to school will have a place to go that they'll identify with and be able to participate in and not be discouraged by. Okay? But we're going to need your help. So if you can put it on your calendars, Saturday, October 3rd, rain date, October 17th, because of the fact that you've got Columbus Day in the middle of it. Okay? So let's hope it's a day. If it's drizzling a little bit, we're not going to worry about that. If it's raining hard, we're moving on to the 17th. But we want to do this on October 3rd. We need your help. We want to thank everyone who's been involved in putting this, particularly thank Reverend Bennett, Jackie Butler, all of our sponsors, and certainly our Director of Communications in Bridgeport Public Schools, Veronica. And I hope that she'll continue to lift her up and all of us up in your prayers. Thank you so much.
Sister Buster could not be here. All right. There you go. All right. Good to see you. We're thankful for Community Health Network's continued support of all the things that are happening educational-wise in our community.
Primary health care services to this committee for many years, and now we are working with the school system to provide services for the school-based health centers. I hope that we can be able to take away information that will help us further our learning, our education, and our lives from what we've got to learn experience today from two individuals who have a lot to offer. Thank you.
Present Dr. Steve Perry and Veronica Douglas Devine will present Ms. Kendra Smith. You can look in the program and see just a little small paragraph of, not even a cliff note of what Dr. Perry has been about, his journey on earth. How many of you all have seen Black America 2? All right? For what you saw there, let's give Dr. Perry a hand. So often, I've learned, and Dr. Kelly, Craig Kelly, he knows because he's a great man as well. Oftentimes, the real great people we know are dead people. Because we don't always know how to give people their props while they are living, give them their due while they're living. And this whole nation, from California all over, is celebrating the dedication of Dr. Perry, getting up at 4:30. Some of us said, we know we ain't getting up at 4:30. We know we're not getting up at 4:30. All right. So Bridgeport, surrounding town, we want to do our part in celebrating a great brother while he is around us. We celebrate Dr. Steve Perry.
I heard Kimba's story and then started to research, and I read the Essence magazine and the Merge magazine. And at the time I was working in the newsroom and always looking for stories about us. And I got her number, got her address in Aery prison, and I wrote her a letter. Because what I said to Kimba in the letter was that I'd love to interview you, not only because I want Connecticut to hear your story, but your story could have been my story. And I shared in the letter with her how I met a young man at the college campus. And there wasn't a lot of brothers on the college campus I went to at all. And he said some great things. And if it wasn't for my brother who told me then, he's not right. The brother's sleeping, I could just feel it. Something told him. And I listened to him and decided not to date him. And I shared that story. So I was hoping to interview her, and I didn't hear back. But then ABC called and said they were interviewing her, and I was able to get the tape. And then the sister was giving a party from President Clinton in 2000. Yes, she was supposed to hear me young people. She was supposed to do 24 and a half years in prison, and she never touched drugs. But she's going to tell you what happened. And we met up, the Qs brought her to Connecticut, and we sat down, myself, Keith Coons and I, and we said, we want to tell your story. And we told her story, and it was the #1 story of the evening. That means that we were watching, y'all. We were watching. And the sister this morning shared with young people that received perfect attendance and others from Workplace Incorporated her story, and young ladies were in tears and thanked her. So I want to thank this sister for sharing, because sometimes it's hard to share your personal stories and let people know what really happened behind the scenes and what she went through behind the bars. But she's going to share that story. So please, Kimba, just stand so everyone can see you, because we're going to bring it up.
I think sisters, we're going to break up. Sisters, we're going to be in the sanctuary. And men, we're going to join Dr. Perry and Dr. Holmes. I just want to lift up our lead facilitators. For the men, it will be Dr. Ken Holmes, Dean of Students at UB. Amen. And Reverend Lisa Ina Elise Anderson. She will be facilitating our sisters along with Sister Henderson. Amen. I think that's it. We're ready to go now. We will meet for approximately 1 hour, am I correct? And then we'll come back in for concluding remarks, because we know we're going to get home before too dark. Amen. All right, you may be listening.